Welcome back everyone. I'm happy to see you in this lesson, and as I promised you before, this is to show you the instructions on how to use a derma roller. If you remember, we said derma roller is microneedling at home, and I'm going to show you my derma roller. This is Meso Age derma roller, and when you take it out of the package, this is what it looks like. Going to take it out more so you can see close up to what the derma roller actually looks like. So it's a device with mini needles, and this is quite a big one. Like, the needles are quite long. It's like around 2 millimeters of needle in this one. But I do advise you that if you start off, you start with a smaller size and you start working yourself up from a 0.25 and increasing the needle size like every 2 weeks. So I'm going to start to show you how you can actually do microneedling at home with your very own derma roller. So first of all, just a few tips you need to know about the derma roller. First tip is that you can only use your derma roller. No one else can borrow it or use it or anything. It's your own personal device, same as a toothbrush, same as a towel. The only one that can use it is you. The second tip is, if you experience any level of pain whatsoever with your derma roller, please stop using it and either wait and use a smaller size needles, or like wait and see what if your skin is extra sensitive. Maybe you're not a good candidate for a derma roller, but it will be having a minimal amount of pain in the beginning. So I mean, that's what you should expect. But if it's too intense or too much, I do prefer that you can use a numbing cream like an amla cream or something to numb your skin, like half an hour before starting using your derma roller. The next tip I want to share about the derma roller is to use it only once or twice per week. Don't overdo using the derma roller, because that could actually harm your skin more than helping it, and more than stimulating collagen. It can actually make irritation and inflammation in your skin. So maximum is once to twice per week, and I do suggest that when you start off, you just start with once a week. The last thing I want to share about the derma roller is the way you wash it is you soak it in water, like you soak it in warm water for like 2 minutes, and you can also spray it with 1 spray of alcohol, and that's the only way. Wait till it's dry and then put it back in its box. That's the way. You don't try rubbing or like shampooing or anything. Just soak in warm water, take it out and spray of alcohol, and that's just after you've used it once. So let's talk about how does a derma roller actually help our skin. So as you can see, the derma roller has small needles that we roll on our skin, and by rolling these needles we form microscopic punctures or small wounds, very small minute wounds on our skin, our face. It can also be used on the hair, on the scalp, and this microscopic wounds create like an injury to your face, which stimulates your body to heal itself. And the body heals itself by producing collagen and elastin. And that's how we get the buildup of collagen and elastin in our face after using the derma roller. This is the mechanism which is used to make our skin firmer, to produce collagen, and to make us reduce any fine lines. So the derma roller effect, you cannot see it straight away. It does take a minimum of maybe 3 weeks to 1 month of usage, like once a week or twice a week, to actually feel the smoothing of that skin. but it can help us in many ways. It can reduce our signs of aging. It can decrease our fine wrinkles. It stimulates our collagen and elastin. It improves our skin tone and the texture. And it actually increases the absorption of nutrients after usage. So usually after using your Dermaroller, you're gonna apply your hyaluronic acid or any serum or niacinamide or peptides that will be actively absorbed more straight after using the Dermaroller. So it has many benefits for our skin. It can also be used on our hair to stimulate hair growth, and we can use it with minoxidil, the spray, but that I will cover in another course, for hair growth. So it has many benefits. It's also very easy to use at home, so it can be done at home. You don't have to go to any clinics or hospitals to do so. It's less time consuming. It's cheaper, of course, and you can do it many times. So it's like actually going to a doctor's office to do many sessions of microneedling. This can actually save you a lot of money, and the turnover time or the minimal recovery, it has very minimal recovery time. So once you do it, after a few hours, your skin is back to normal. Of course, there might be a bit of inflammation or redness, but it will calm down. So there is none to very minimum recovery time. Just to complete our conversation, there are some contraindications to using a Dermaroller on your face. If your skin is sunburnt, if you have an open wound on your skin, or you have an inflammation on your skin, or you have active acne, you cannot use the Dermaroller. Either you have to treat that, or you have to wait until your inflammation has gone away. So Dermaroller has to be used on completely healthy skin. Okay, let's see how we're going to be using our Dermaroller. So first of all, you have to wash your face, cleanse it from everything, from makeup, oily things, any sunscreen or anything you have on your face. So say my face is completely washed and cleansed. Like I said, we have our Dermaroller that has previously been sanitized with alcohol, warm water and alcohol, and it's for only you. No one else can use it. So we're gonna start with our Dermaroller, and we're gonna divide our face into areas. So the first area being our forehead, the second areas being our cheeks, and the third area being our chin area with the nasolabial folds and the side of our face. And the fourth area, of course, is our neck, because we can also use it on our neck. So first we're gonna hold our Dermaroller in the hand, and we're just gonna press gently against our skin. And we're gonna roll up and down in a very ordered motion like this. 1, 2, 3, and 4. Next section. 1, 2, 3, and 4. Next section. 1, 2, 3, 4. Next section. 1, 2, 3, and 4. Last section of the cheek. 1, 2, 3, and 4. So as you can see, this part that I've done with the Dermaroller has become a bit red, which is normal. This is because of the microscopic wounds performed. And after we've done rolling in a vertical manner, we go over the same section, but in a horizontal manner. Of course, I pass it 4 times. The maximum is till 10 times, but if you're just a beginner and you're starting off on this, I do recommend only doing 4 times. So let's do horizontal for our cheek, and let's go. 1, 2, 3, 4. Next one. 1, 2, 3, 4. Next one. 1, 2, 3, 4. So as we can see, the difference between the two cheeks, this is a bit like, we call it hypererythema, or it's a bit red, and this is because of the microneedling, because of the tiny needles on our dermaroller. We start another section on the lower cheeks. So 1, 2, 3, 4. We move on. 1, 2, 3, 4. We move on. 1, 2, 3, 4. We move on. 1, 2, 3, 4. And again, horizontal. I'm not going to do it again, just like horizontal. We're going to do 4, 4, 4, 4 again. Okay, so forehead, same thing. We're going to divide it into sections. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. As you can see, my forehead has turned a bit red, and we go the same on the horizontal. There is no contraindication to going over your lips. Actually, it's good for your lips as well. So we can go 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Just note that the skin under your eyes is a bit thin, so if you're gonna do under the eyes, just very gently press, not too much like the rest of your face. And we can still go under the eyes like 1, 2, 3, 4. 1, 2, 3, 4. Same at the corner of the eye. 1, 2, 3, 4. 1, 2, 3, 4. As you can see, there's a bit of redness around my face. Same on the neck. We'll just do section by section. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, and continue. Also under your chin. 1, 2, 3, 4. 1, 2, 3, 4. So now you've got the idea on how to do the dermaroller. You're going to divide your face into sections: forehead, cheeks, chin area, side of the face. You can do your lips and under eyes, but make sure to apply less pressure. The pressure is not too hard. It's just a normal small push against your skin, and decrease that push when you go in sensitive areas. You can do your whole neck. As you can see, I have redness here. And that's the way you dermaroll at home. And once to twice per week is the max. Please do not dermaroll more than twice a week. Otherwise, you will end up hurting your face more than actually benefiting your face and your skin. The last thing I want to say about dermarollers is after you do the dermarolling session on your face and your neck, it's amazing to put your serum straight after. So if you have a hyaluronic acid serum, that the ones we discussed before, or some kind of mask that you want, a specific kind of mask, niacinamide or has peptides, you can apply it straight after your dermaroller. Some people do apply vitamin C, but I don't recommend, because with the micro pores and everything, the vitamin C will have a bit of inflammatory effect. It's like putting lemon on something that's wounded. It will hurt you a bit. So go more with moisturizers, go more with hyaluronic acid serums, go more with masks. And as we said, once to twice per week only. And the way to wash it is just soak it in warm water after you've done for 2 minutes. Take it out, a little spray of alcohol, wait till it dries and put it back in your box. And I promise you, if you use your Dermaroller twice a week, you can start with a small needle, you will definitely see an amazing change in the texture and tone of your skin and a fading of your fine lines and wrinkles over time.